Hi, everybody. I'm Donna Terrell, and welcome to Terrell Talk. Coronavirus cases in the U.S. hit the 1,000 mark, and at the time of this recording, Arkansas dealing with its first possible case of the infection in Pine Bluff. In response to Arkansas seeing this first case, Governor Asa Hutchinson is restricting out-of-state travel for state employees, but he's telling Arkansans not to panic. Take a listen.
At the current time, there's not a need to do all our work remotely. There's not any need to disrupt our state services. Our business will continue as usual, but we are prepared in the event that there is a necessity of it to go into more remote operations to continue state services.
And it seems every day the situation with the coronavirus is evolving. So joining me now to talk about this disease and its spread is Dr. John Vinson from the Arkansas Pharmacists Association. You're the CEO of the association. Thank you so much for being here.
Thank you.
You were at the governor's press conference today. What was your takeaway?
The governor did announce that there's the first, as you mentioned, first presumptive case in the Pine Bluff area from a citizen who had traveled elsewhere. And I thought the governor gave good, sound advice to not overreact, to continue business, enjoying our great states, the natural state. You know, I know one of the things he said in the press conference this morning was to think twice or to consider your travel plans that you may already have planned over the next few weeks, including spring break travel. I know that, you know, for example, my family, considering a trip. We're actually looking to maybe do something here a little closer to home over spring break. Arkansas has some natural advantages when there's an outbreak like this. With a smaller population, we don't have public transportation like a lot of other states do, or international travel. The disease itself, even though there have been deaths and there have been over 1,000 cases, it's certainly at this point not widespread or enough deaths that we should be too concerned yet, but we should take it serious.
Well, you know, I've heard a lot of people say that there's been an overreaction with this disease, and some are even saying it's no worse than the flu. Would you agree with that? It
is similar to the flu in terms of both are viral illnesses with similar treatment modalities, and there are certainly deaths from the flu. For example, in Arkansas, we've had about 69 deaths and a couple of children with the seasonal flu, and we see that every year, thousands of cases. The one thing that's a little different is that it's a new virus and a new infection, and there's still some unknowns.
There's the fear of the unknown with it.
Correct.
Yeah. How do you treat coronavirus?
Currently, for the most severe cases, they would be hospitalized with supportive care. You know, any comorbid conditions like diabetes or asthma certainly would be supported while they were in the hospital. But good standard things like rest, Tylenol and ibuprofen for fever or pain, throat lozenges for sore throat because it's an upper respiratory infection.
So if you don't have any underlying illnesses, then like what you're saying here, Tylenol, ibuprofen, throat lozenges, plenty of fluids, just like with the flu. But when we talk about underlying issues, are we talking about things like diabetes, heart condition, someone being on, dialysis or something like that?
Yes, certainly Americans with those conditions would be at a higher risk of having a more severe form of infection as they do with flu.
Okay.
And so, out of an abundance of caution, for example, if you were planning to travel to a conference where folks were coming from all over the world, or to a place like Disney World where you have folks come from all over the world, or Disneyland, California. I know there's been more cases in California. You might think twice if you were older, if you were above 60, if you had underlying conditions before visiting a place like that, at least until we have a better handle on the situation.
Okay. What about traveling out of the country? I mean, and now obviously we're not talking about going to China or to Italy, but what if someone wanted to go to Africa, South Africa?
Right. There are cases all over the world right now. There are only 5 as of this morning. There were only 5 countries that were either level 3 or do not travel at all, according to latest recommendations. But in terms of Africa, every continent in the world right now does have cases, with the exception of Antarctica. So you just have to do a little research to see how prevalent it was before you traveled there.
And
if you were older or if you had any of those underlying conditions,
then maybe not go at all. Okay. Surgical masks, you know, it's interesting. I haven't seen a whole lot of people in the areas that I frequent around here, but on television you're constantly seeing people with surgical masks on.
They're hard to find right now.
Well, they're a hot commodity for sure. And what I also keep hearing is you don't really need one unless you're ill.
Correct. The real value in a surgical mask right now is if you yourself have the flu, or you yourself may have been exposed or have some kind of upper respiratory tract infection, including coronavirus. If you're sick and you're coughing and you're sneezing,
you should wear one.
Yeah, you should wear one. And if you don't have one, something like a common handkerchief, you know, would suffice to keep those droplets from transmitting as much. But if you're not sick, that's not going to prevent you from becoming infected.
It was interesting because you mentioned before we actually went on air with this that a handkerchief. I'm like, this takes us back to when I was a little girl. My dad would always have a handkerchief. My mother would always have one. But it's something that certainly we could use in lieu of not having a surgical mask, or you know, for people who feel like they need one, it would just be something that they could do.
I agree.
What about, being that you're a pharmacist, you know, a lot of people are probably thinking, okay, what's going to happen if I have to self-quarantine? You know, what do I do? So in terms of getting medications and things like that, because a lot of people aren't going to want to come to their home and bring them things.
Right, great question. So pharmacists in Arkansas are in all 75 counties, so they're highly accessible. And then they're still open right now, and they're serving people as they always have. They're going to do that. If one thing to consider is a lot of the insurance companies, and they haven't all done this yet, but I suspect in the coming days they'll relax things like allow overrides for early refills, so that you can, you know, have a supply of your medication on hand.
So you can have more than just a 30-day supply.
Correct, that too, be able to fill more than a 30-day supply. And then remember that most pharmacies have a drive-through or offer delivery service, hand delivery, and even CMS at the national level for Medicare and Medicaid yesterday, coming out of the White House, they've encouraged all of our federal plans to relax their refill policies, their 90-day supply policies, and their home delivery policies.
Are you at all concerned, though, as a pharmacist, with someone coming in needing medication because they may have been exposed to the coronavirus and then exposing it to more people who are at the pharmacy, or even some of the pharmacists and workers behind the counter?
There's certainly concern with that, but there's also concern with that with the common flu. You know, we advise our patients, if you have those kinds of symptoms, it's always best to stay home, and if you don't, using a drive-through or delivery service is probably preferred, especially during a time of a pandemic. You know, the World Health Organization just this morning did declare this a pandemic, you know, a worldwide disease.
And I will tell you this, it's interesting when we call it a pandemic and we tell people not to panic, because it's just spreading, and it's, you know, and now it's in Arkansas, and it does make you want to go into a panic.
Right. It's natural to want to do that because we don't see these very often, but I think it's the wrong response. I mean, we have a single case. There could be cases, but if they are here in Arkansas, they're not severe and they're mild, and they're not being seen yet. I know our state and our nation, you know, has plans in the near future to do more testing, and I really believe as they find more cases through testing, we'll find that the mortality rate or the death rate is lower than what they've initially
than what they've been saying. We just haven't tested enough people at this point.
That's what I feel.
Am I missing anything here? Is there anything we need to share with Arkansans, just so we're all on the same page?
Yeah, I would just say go see your pharmacist. They may have your supplies and some of the medications we talked about earlier.
In case you want to stock up.
Yes, if you want to stock up on Tylenol, ibuprofen, throat lozenges, fluids, and water. And get your medicines filled that may need to be refilled anyway. You know, now's good a time as any to do that, to stay adherent and prevent exacerbations. Also, infectious diseases like flu, which we touched on, it's not too late to get a flu shot. The more flu shots that are utilized, the less flu there is in a community. And our hospitals, if there is an outbreak in Arkansas of coronavirus, a more severe outbreak, which could happen, if we see that, it would be nice to not have also flu cases. The more people that get vaccines and prevent it, the less competing, spots for beds and resources there are.
What if you had your flu shot? For example, I had my flu shot in October. Should I be getting another one now?
It's not recommended to have 2 in a flu season. There's data that it could last even longer than a flu season.
Okay.
But they recommend getting it every flu season because the strains can change, once a year.
Well, it's funny because I think I got a different strain because I did get a flu shot in October, and in January I got the flu.
Yeah. I mean,
and that happens.
Well, the flu shot's not 100% effective, but most people that get the flu after getting the flu shot have a milder case that doesn't lead to hospitalization. So once again, the less people that are in the hospital, the more capacity we have if we do have an outbreak. So.
Do you think one day we'll get to the point where this is, we understand it better? There's a vaccine, and if you get the coronavirus, it's not like all panic and everyone's staying away and, shutting down schools and all of these different things. We'll see less of that, right?
I agree with you. Okay. I believe that's coming.
I would like to see that day soon.
Me too.
All right. Thank you, Dr. Vinson. Thank you so much for coming here. And that is going to wrap it up for this edition of Terrell Talk. I hope you got something meaningful out of this and something that can maybe calm some of the fears over the coronavirus. We'll keep you posted on other things you should know, and always join us on Fox 16 News at 5:30 and 9. Have a real nice day, everybody. So long.